Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes or so discussing a means that we need to use to satisfy the needs of our prospects and clients. Folks with basic medical coverage sometimes have areas of particular need, and that is best served by some of the ancillary products that we have to offer. So we have a guest speaker in from SureBridge that gives us some additional tips on selling these products to the population that really needs them. You'll find that today's presentation is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel as well. And in the software system for this presentation, there's a section for both questions and chat. We find that we normally cover the questions through the course of the presentation, but we want to make certain we address any inquiries that you have in order to make certain that you get full value out of participating in today's presentation. It is aimed at agents of different varying experience. So for some of you, this might be brand new. For some, it might be a welcome review. So we'll start then with a little bit of level set when it comes to Premier Marketing. For those of you that aren't as familiar with us, we are a national marketing organization that's founded in 1968. That's part of the Integrity Marketing Platform. We're licensed in all 50 states and we act as an insurance wholesaler through independent insurance agents such as yourself. And we do so through contracts at the highest possible commission levels with recruiting contracts available to those who qualify. That's accomplished through a full portfolio of products, including the base Medicare programs, the Medicare Advantage, Medicare Supplements, standalone Part D drug plans, but also a full portfolio of life insurance and annuity products, final expense life insurance, pre-need plans, long and short-term care programs, disability income plans, and the ancillary benefits, much as what we're going to discuss today in these categories that satisfy specific needs of our target population. When we look at Medicare Advantage, well, you got the leaders across the country in this portfolio available to you through our organization, and that comes with the accompanying prescription drug plans, where most of these are part of that MA contract. A couple of exceptions, Mutual of Omaha is a standalone different adjunct contract, and Clever RX is actually a discount program and not a Part D prescription drug plan. When we look at Medicare Supplements, the portfolio is robust, and we have tools that help you be successful in this space as well. We want to make certain that we're able to address the needs of the Medicare population, the senior population across the board. And so we aim to take care of people regardless of income, health status. Ancillary products, as I mentioned before, in each of the categories, you have the national leaders. And this is a way for us to not only take care of specific needs of our prospects and clients, but also give us a little bit of marketing flexibility and, of course, another revenue stream for our agencies. When you look at the Medicare market overall, you don't come on a program like today without hearing of the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day. It's tempered a little bit by the folks that are choosing to work past the age of 65 or deferring their Medicare benefits for another reason, but that's more than made up for by the folks that are under the age of 65 and are accessing benefits because of disability. Huge number, huge market. And we need to make certain that we realize that this is our target market, but a lot of what we discussed today will even go beyond these numbers, because in many circumstances, the ancillary programs are not age specific for the senior population. So we have a lot of people to speak to about these programs, and we need to do so clearly. And so we have an acronym guide taken from the CMS website. Look at that, 4,420 of them. Well, that reminds us to be able to define the acronym when we use it, minimize it, and communicate properly with the folks that we're discussing their options, because they have a number of them. You go on Medicare, you could actually defer Part B or decline it depending upon your circumstance. Some folks will take A and B, self-insure for the medical cost shortfall, pick up a Part D standalone drug plan to help with the medications. Others will pull up and enroll in a standardized, modernized Med Supp and a Part D program, or others will go into the bundling of the Medicare Advantage plans. In each of these areas, Ancillary programs are very viable products because they cover shortfalls in any of these choices. So we want to make certain then that we help people with their choices because they're not doing it themselves. Kaiser Family Foundation tells us that the vast majority of people on Medicare programs don't do a year-over-year review, regardless of the television commercials, our outreach, and everything else that comes from the carriers as well. So we want to make certain that even if their base coverages are on one option or another, we're able to deliver these sorts of plans to help them with their choices. Because look at that. They're not using Medicare resources. They're not even necessarily studying their Medicare and U book that's sent to them electronically or by snail mail. Utilize a app to find out what's covered. Some do, not many. And of course, they're not even using some of the informational presentations that are available online from Medicare. So we want to make certain then that we deliver information to folks that help them understand it. We speak to it in a number of ways that help them understand what they are receiving, and then we deliver it. Okay, do they want it in person? Do we do it virtually? Do we do an overwrap? Whatever it is, we want also partners that can help us deliver that information in such a manner, because folks are becoming increasingly digitally savvy in our target market because we've trained them. Well, the world's trained them since the pandemic hit. Look at doctors and specialists. Many of those appointments were done virtually. Some still are. A lot of the prelim work for a hospital stay or a dentist office visit done digitally beforehand. It even affects our everyday life in the way that we celebrate our faith. Much of that is done online. So if we have the systems in play that can help us deliver that information, explain it properly, it's going to work out well for everyone because we satisfy their need for information and we are able to manage our time a little more efficiently and, of course, deliver detail compliantly. When we look at the different election periods that are part of the Medicare world and the special election periods and the special election periods that are trumpeted by the different carriers, we need to keep in mind that the products we discussed today aren't subject to lock-in. They aren't subject to an enrollment period dictated by the government. Now, there are things we need to do in order to make certain that we enroll people properly with these programs, but keep in mind, this is year-round activity, year-round revenue, and of course, year-round coverage for the folks that we speak with. So we've invited our friends from SureBridge to come on and visit with us and give us some detail on offering these programs to our target market. So at this point in time, I'd like to invite Seth Groff, who's a National Sales Director for SureBridge, to come on and visit with us about these programs. And bear with me, Seth. I'm going to turn this over to you.
Awesome. Well, thanks for that great introduction. And thanks everyone for jumping on today's call. Bear with me real quick. There we go. Perfect. Yeah, John, as you mentioned, now is just a great time to be talking to your clients about ancillary products. Unless you live under a rock, that, the out-of-pocket costs of, associated with healthcare is a big concern for a lot of consumers. They're looking for strategies to help, pay for these out-of-pocket costs. And, I always say, second quarter or third quarter, before we get heavy into AEP, is the perfect time to reach out to your existing clients about these products. And so, they're looking for them. They need strategies to pay for out-of-pocket costs, and so you can be a solution there. And then the other thing that, I've really been communicating to agents, is that we're from a, economic standpoint, the country is having some troubles. And I know that, the commissions that you once earned just doesn't go quite as far. That they used to do just with inflation and everything else. And so if you're looking for an easy way to increase your revenue per client, ancillary products is the great way to do that. And since we can sell these year round, now is just the perfect time to talk about these products. So really excited for today's call. As the title indicates, I'm going to share 3 tips for selling ancillary products in the senior market. But I also have a lot of other things that I want to cover today. If you're familiar with SureBridge, we've had a lot of changes going on, most recently in the past week. And so I want to make sure everyone on today's call is aware of what those changes are and kind of how they can benefit you. So in the lower left-hand corner there, you can see that we are SureBridge, underwritten by the Chesapeake Life Insurance Company, but we're actually going through a brand change. Today's presentation, some of my slides are actually going to have some of the new brands, and so I want to walk you through that. So we are actually owned by United Healthcare, and we are transitioning to the United Healthcare brand, and I'll walk you through what that looks like and kind of what the advantages are for you there. Also, in the senior market, we actually launched a new accident plan as well, called AccidentWise, and I want to kind of walk you through what that product looks like and how it can benefit your senior clients. And so you can see here, new product, new brand, and I'm going to kind of walk you through what that looks like, and then at the end share the 3 tips to sell more ancillary products out in the marketplace. So why did we launch a new accident plan? If you're not familiar with our previous portfolio of products, we had some great accident plans out there, and there's a couple of reasons why. Our strategy from a product development standpoint has been to really expand into that senior market. And, we did that with, our DDH plan that you're probably familiar with. We did that with our guaranteed issue benefits on our hospital indemnity plan, which I'm going to cover later in today's presentation. And now we actually have an accident plan that not only is available in those over 65 ages, but it's also has a lifetime renewability, where a lot of other accident plans terminate at some point in time. So it just kind of followed our natural progression of product development to go out into that senior market. Also, it's we always do heavily research the market. We looked at some of the benefits that are out there on accident plans, and we were missing a couple, specifically outpatient surgery and AD&D. And so we actually expanded the benefits available on this plan as well. And then most importantly, this is actually the first product that carries the United Healthcare brand. So as I kind of started with, we were previously SureBridge, underwritten by the Chesapeake Life Insurance Company. We are moving to United Healthcare, underwritten by the Chesapeake Life Insurance Company. The key between this transition is that bottom, the Chesapeake Life Insurance Company, or CLECO. Okay, it doesn't mean that you have to do a new contract. It doesn't mean that you have 2 different applications. It's just that we're, instead of SureBridge, it's now going to be United Healthcare. And so, as I mentioned, this is an ongoing process. I'm going to try to refer to everything as CLECO instead of SureBridge, just so we can kind of go through it. But really, the advantages of this transition is that number one is leverage the United Healthcare brand. SureBridge just didn't have the household name that United Healthcare does. And so we're excited to, give you the opportunity to leverage that brand. Also, if you're selling the Medicare, United Healthcare Medicare products, or the Medicare Advantage plans, or even under 65 ACA plans, it's going to establish brand continuity between those core products and the ancillary sale. So, sometimes it's hard to get that core sale and then, talk about an ancillary product because it's, owned by a different company. Here it's going to, kind of create that continuity. You're still going to have to do 2 apps, from those core products, but at least the name is going to be familiar with the client. If you're familiar with CLECO and maybe our critical illness or our DVH or our hospital indemnity, if you're enrolling in multiple products, it still remains on 1 application, and it's still going to be 1 bank draft for those CLECO products as well. But the bank draft did change, and so where it used to be Chesapeake-SureBridge, it is now actually currently Chesapeake.UHC. So that's kind of what the process is going to look like. But the new product, AccidentWise, carries the brochure logo. You might be saying, what about the other products, right? What about the hospital indemnity DVH? So we'll go through a process of transitioning everything over to the new logo. By June, we're going to have our CancerWise, HeartWise, and HospitalWise all transitioned over. We're actually going to have a new dental vision hearing product in June as well that will have the new logo. And then after that, really, there's just a term product that will come over in Q3, and also disability. So unfortunately, it's kind of a big undertaking, with this brand change. And so it is going to take some time, but you'll start seeing the United Healthcare logo out in the point of sale tool Here in our e-market, it's showing up now. We removed any reference to SureBridge. We use the Chesapeake Life Insurance Company in the point of sale tool to kind of make this transition. Again, there's another area where United Healthcare will show up. We removed, here was where a logo for SureBridge. Now again, it's going to be the Chesapeake Life Insurance Company. There's a cover page that referenced SureBridge that we removed as well. And then the billing statement you'll see now is coming from ChesapeakePlus.com with the United Healthcare logo and that billing of Chesapeake.uhc. Also, our members are actually now currently being directed to uhcmemberhub.com. And so it's no longer going to mySureBridgeInsurance.com. It's coming to this uhcmemberhub.com. So what to do during this transition? Well, first of all, when you're writing clients, explain what's going on. Okay, just let them know that the company was previously, the marketing name was SureBridge, and it's transitioning to United Healthcare because that's who owns us. But then really, put an emphasis on that Chesapeake Life Insurance Company because that's where the continuity is going to be. Remember, Chesapeake Life Insurance Company is the actual carrier that writes the product. SureBridge was just a marketing name. United Healthcare is just a marketing name. And so, that's kind of where the continuity between this transition. But just kind of explain what's going on and make sure they know that if they start seeing UHC pop up, that's because we're going through this brand transition, not only for new clients, but also existing clients as well. So that's an overview of the kind of the brand transition. I know there's a lot of questions regarding that, so hopefully that clarified it. If you are contracted with Clico, if not, that's kind of what's going on. But so just real quick, want to hit on this new product that just launched on Friday, the AccidentWise plan, because it's great for senior clients. I'll kind of talk about where it fits into that market as well. But expanded issue ages 0 to 75 on this plan. Same rate for all issue ages. So, a 12-year-old child gets the same rate as a 72-year-old adult. There's no termination age on this plan. So as long as you have it enforced by 75, they get to keep that plan. Guaranteed issue for all ages, right? No health questions, no height, weight. The only thing that can knock them out is incarceration question. We do allow child primaries on this plan, and it does have a $20 application fee, but remember that fee applies to Clico products. So if you're applying in, a critical illness in an accident plan, it would only be one application. Or if you're enrolling, a husband and wife in this accident plan, it'd only be one application as well. So really excited for the expanded issue ages and the fact that there is no termination age. Up on the screen here are what the benefits look like. We modeled this after our accident companion plan. And so if you're familiar with that plan, I always try to do a kind of a comparison to option 1 here with that accident companion plan. So option 1 here has a $10,000 benefit for the first time you're confined due to an accident per policy year. If you go to the emergency room due to an accident, pays $1,000. If you receive a major diagnostic exam resulting from that accident, you receive another $1,000. And then there's 5 visits that would pay $100 per visit for physical therapy or other follow-up treatment. And if you look at a price, we're coming in with this new plan at $1,546, and those benefits that I just went through on the old accident plan was coming in at $28 a month. And so we created about $12 worth of savings for your client for those benefits. Now, in addition to those benefits that I just went through, we actually added the outpatient surgery of $1,000 if you have option 1, and the accidental loss of life, limb, or sight of $10,000. So we expanded the benefits and lowered the premium about $12 a month. So more benefits for a lower cost. I mean, it's a win-win across the board. Now, a couple things I will point out is that we did break out the emergency room and urgent care here. And so just be advised of that, but you do get 4 per policy year for each of those. So a trip to the emergency room, you get 4 of those, and 4 for urgent care. So, where we came in from a pricing standpoint and a benefit standpoint, I think we're in a pretty good place. And I always tell a story about, one of my friends, Mike, who actually had the accident companion product, but, he was out at a wedding. He was out on the dance floor, slipped on some liquid that was on the ground, and he tore a ligament in his knee. He was in pain, so went to the emergency room, received $1,000. He had to have an MRI, which is, you can see up here as part of the diagnostic, once he got back. And so, that MRI, another $1,000. Then he had physical therapy after that. And so he received $100 per visit. So that one bad dance move, he would have received $2,500, right? And so you can see how this is very benefit rich. And, from a price point of $15.46 a month, basically 50 cents a day, very affordable for both under 65 and over 65 clients. But up on the screen here are the states where this is approved. And these are, like I said, it just launched on the 24th. And so you would be able to offer this to both your senior clients and your under 65 clients today if you think it would benefit them. We are sunsetting our old accident plans. And so if the state's available, or if AccidentWise is available in those states, the old accident plans are sunsetting, but if your clients are enrolled in them, they can keep them. So the question always comes up, and the next product I'm going to talk about is HospitalWise, which we sell a lot of for people enrolling in Medicare Advantage plans. And the question I keep getting is, well, you're always talking about how great your hospital indemnity plan is. Why would a client, why HospitalWise versus AccidentWise? Which one should I enroll my client in? I always go and say, what resonates with your client? And then I use my dad and my mom as an example. I live in Nebraska, grew up on a farm. My dad's, old farmer. He's 70 years old. Last summer we were up replacing the roof on his machine shed. So at the time he was 69, he's 70 now, but he's up there still working, outworking any of us up on the roof, right? And if you go to my dad and start talking about hospital insurance, it's not going to resonate with him, because the last thing he wants to do is think about being in a hospital. Now, going to my dad and saying, hey, your balance isn't quite as good as it once was, you fall off this roof and have to go get, the emergency room to get your arm put in a cast, you're going to have some medical costs. Would it make sense to paying, $15 a month to have some accident insurance? That's going to resonate with my dad, right? My mom is the exact opposite. My mom's a caregiver, took care of my grandpa when he was in a hospital, also took care of my great aunt when she was in a hospital, at the last part of her life. So she wouldn't want something that just covers accident, because although my aunt actually was in the hospital due to a fall, my grandpa was in there because of sickness. And so she'd want to make sure that, she had a plan that would cover them for both accidents or sickness, which would, lead down the path of HospitalWise. So I always start off with what resonates with the client. I really like HospitalWise to cover the costs, the co-pays of Medicare Advantage plans. I'll show you what that looks like in the next portion. But really where I see AccidentWise kind of stacking on top of that is AccidentWise can be used to pay for some of the indirect costs, right? Like, so if you have an accident, now you have to have a modification to the house, right? You have to put up maybe a railing in the shower so you can hold on to it. It's nice to have these cash benefits to use for some of those indirect costs, or maybe you temporarily have to pay someone to come over and take care of you while, again, maybe your arm's in a cast or something like that. So that cash benefit can be used for some of those indirect costs. And at the end of the day, maybe both make sense, right? They receive both benefits, and so maybe both make sense. And it's just something you need to have a conversation with your client. So that's the new accident plan. That's kind of the brand change. And I just wanted to drop that in this presentation because I think it's important to understand what's going on. So now you can see I'm jumping back to my SureBridge slide, just because this product is still carrying the SureBridge logo until June, and then everything will be transitioned over to the United brand. And so again, this transition just happened last week. I haven't had a chance to update all these training decks, and so that's what's going on. But just remember, the Chesapeake Life Insurance Company is kind of where that continuity is. And so, our hospital indemnity plan, kind of in the senior market, where the fit is selling in conjunction with Medicare Advantage plans. We see more and more people going to these Medicare Advantage plans. They have co-pays, and so the hospital indemnity plan can kind of fill or pay for those co-pays. And so, we see more and more people enrolling in these plans. This was from 2022. I'm sure after the 2023 enrollment, I'm sure this has increased. And so we see more and more people getting into these Medicare Advantage plans. But there's a maximum out of pocket that you need to educate your client on, right? The average in 2021 was a little over $5,000 for in-network, and a little over $9,000 for out of network. And so, you know, for a senior on a limited income, maybe only living on Social Security, a little bit of savings, that could be a large check that they would have to write. And, you know, statistically, 69% of Americans have less than $1,000 in savings, right? And so, you know, it's a real issue out there. People just don't have the savings available to pay for, you know, write a check for $5,000. And so we can use Medicare Advantage to kind of bridge that gap with our, or excuse me, we can use hospital indemnity to kind of bridge that gap with your clients enrolled in Medicare Advantage plan. So really up on the screen here, this is the concept that we're doing. On the left is a common Medicare Advantage plan that you can see has copays for hospitalization, outpatient surgery, emergency care, a ride in the ambulance, skilled nursing confinement, and major diagnostic exams, okay? And so those are common copays. You can come in with a hospital indemnity plan and kind of dial in those benefits, and this would pay the client cash that they could use to pay those copays. So you can see we did a 6-day benefit, $300 a day, outpatient surgery for $250, emergency care rider of $100, ambulance rider of $200, skilled nursing rider of $200 for days 21 through 100, and then a major diagnostic rider of $200 as well. We're coming in at $52.38 a month, and now we have a plan that, you know, basically is going to eliminate most of those copays associated with that Medicare Advantage plan. So this is the concept. Now, what stands SureBridge, or I should say CLECO or HospitalWise, I'm going to use HospitalWise. What makes HospitalWise stand out from other hospital indemnity plans out in the marketplace? It's our guaranteed issue benefits, okay? And so back in September, we launched guaranteed issue benefits, all issue ages 0 to 90. You just have to stay under these thresholds, okay? And so I know a lot of our competitors, great carriers out there, great products, but they have limited guaranteed issue ages, where ours, all issue ages 0 to 90 year round, you just have to stay under these thresholds. And so you can do a 3 or 6 day benefit up to $350 a day, ambulance rider up to $200, emergency rider up to $100, outpatient major diagnostic rider up to $200, surgery rider $250, and then the skilled nursing rider days 21 through 100, you could do up to $200 benefit there. If you want higher benefit amounts, we have them available. It's just going to be simplified issue underwriting, okay? But you can see that where we have those thresholds, you know, stacked at, we're going to cover most copays. You know, in the example I just showed earlier, I think the ambulance, you know, copay was like $250, and we dialed it down to $200. That was just to keep it GI, okay? If I want to do $300, I could, but then it's going to be simplified underwriting. Our simplified underwriting is just questions on the application. But that's kind of how that's going to work. But we're seeing a lot of people keep it under those GI thresholds for 3 reasons, okay? Number one is that it eliminates any doubt as to whether or not that client's going to qualify, right? No health questions, we know everyone's going to qualify there. Also, it kind of eliminates that awkward conversation coming off of Medicare Advantage enrollment, you know, that's guaranteed issue during AAP. Coming off of that and then saying, hey, I have to, you know, ask you now 10 questions for this hospital indemnity plan. That can be an awkward conversation. A lot of agents were not willing to do that. And so now that we have these, they don't have to ask those health questions. And then the third reason is it drastically shortens the application, right? Basically, grab some demographic information and then there's no, you know, health questions. So what shortens the enrollment process drastically. That's kind of what I think our value prop is on this product, but, you know, other nuts and bolts, we do have an individual and spouse rate. So if you're enrolling a husband and wife, they do get a little bit of a price break there. Always list the younger spouse first. That seems to create the lower or the most savings. There is a pre-existing condition clause. It's going to have a 6-month look back for the first 6 months of the plan. That's for both the GI and the simplified issue. So if you've been treated or diagnosed for any conditions, 6 months leading up to the plan, it's not going to be covered for the first 6 months of the plan. Other than that, no waiting periods. So no waiting periods for accidents, no waiting periods for sickness, as long as it's not a pre-X. If it's pre-X, there is that 6-month look back for the first 6 months. And this does have that same one-time application fee that we talked about on the accident plan. But remember, if you did an accident plan and a hospital indemnity plan, it would only be 1 fee. A couple other things on this plan. Remember, you select your daily benefit period, We have a wide range there built into the plan: observation benefit and mental nervous benefit. The observation benefit is huge. We see a lot of times people aren't actually admitted to the hospital due to billing, the way they're setting up billing. With our plan, as long as they hit that 12-hour mark, they receive the benefit. Mental nervous issues are, continue to be an issue in the U.S. And your client, if can receive up to $250 a day for a maximum of 7 days if they're hospitalized due to a mental nervous benefit, where some of our competitors actually exclude that. So just some built-in plans, but then it goes to selecting the riders, and some of these are going to be more applicable to that senior market. For example, lump sum hospital confinement rider, that's typically sold in the under 65 market, because just to cover the deductible and any co-insurance. But these other ones are going to be more designed for that over 65 market. They could be under 65 as well, but we're just kind of talking about Medicare, or selling in conjunction with Medicare Advantage plans. So outpatient surgery rider pays that for outpatient surgery for sickness or injury. Skilled nursing facility rider, what I always like to highlight is how that benefit period can be 21 through 100, right? Because most MA plans are going to cover, that hospital confinement, or excuse me, that nursing facility confinement following a hospital confinement for days 1 through 20, and then this kicks in for days 21 through 100. Emergency care rider, this is a real popular rider for a couple of reasons. Number one, it's not contingent on hospitalization, okay? So you don't have to be hospitalized. And then it also covers you for sickness or injury, okay? So 4 times a year, you're at home, you're cooking dinner, you're, chopping up a potato, cut your finger, have to go get stitches. It would pay, right? Not feeling good and it's getting worse and you just feel like you can't make it to the morning to go see a doctor, you go to the emergency room, it would pay that benefit as well. So doesn't have to be hospitalized, sickness or injury. Ambulance rider pays that benefit for a ride in the ambulance, and outpatient major diagnostic rider pays that benefit for those particular exams there. One thing I will say about the emergency care rider is that it does have to be an emergency room attached to a hospital, okay? Urgent care does not count for this rider, where on the accident plan, that is acceptable. So those were showing all the benefits. I always like to show this up one last time of the guaranteed issue thresholds, because if you keep it under those benefit amounts, then it's going to be guaranteed issue, no health questions. From a state availability standpoint, everywhere in blue has the guaranteed issue benefits available. Again, we launched them last September. We saw it's about 100% growth with this plan now that we have those GI benefits. So we've really made an impact kind of in that market, and we're really happy at the results that we've had so far. States in pink: Illinois, Virginia, and DC. The hospital indemnity plan is approved, but only on it's only going to be on a simplified issue basis. So it's not going to be any guaranteed issue in those states in pink. The other thing I should point out is in California, the maximum issue age is 64. Okay, so California does not let our ancillary products in that over 65 market. So is it approved in California? Yes, but you'd really have to be, working that turning 65 or below market, because that's the maximum issue age in California. All the other states in blue, it's going to be 90, which is pretty nice. We already hit on the pre-X. Just remember, 6-month look back for the first 6 months of the plan. And then if you're curious about, going simplified underwriting, these would be the knockouts and the look back periods. But you can either use this, otherwise the questions are in the product guide, or you can just go through the application and that'll walk you through them as well. So the last thing I want to show you is that we do have this great HospitalWise Senior Plan Builder. What this does is it actually allows you to select the Medicare Advantage plan that you are selling. So here you can see I did a United Healthcare. Well, this is 2022 plan year, but we did a Medicare Advantage plan, list the copays, and then it makes a recommendation for HospitalWise. Okay, so based on the exact plan, Medicare Advantage plan the client is enrolled in, it'll make a recommendation for HospitalWise. So you can use this in the sales process. You can print this out ahead of time, pull it up for the client, but this does a good job of laying out what the copays are. and then also what the recommendation is for that. Jumps right over into the quote tool, and you can do that to run a quote. Now, the one thing I will say is that the quoting system doesn't have guardrails to prevent you from, quoting simplified issue, right? And so, for example, this plan, it's always going to recommend, the benefit to fill in any of the copays. So we did $400 there, and then ambulance rider $300, and so this would actually be simplified issue underwriting. If I wanted GI, I'd have to lower that to $350, and I'd have to lower that ambulance rider to $200. Okay, so there's not like a button you can push that says GI. You would be responsible for making those adjustments. But you might say, well, Seth, how am I going to remember what those guaranteed issue benefits are? And right here in the actual illustration software, it's listed right there, so you can reference this to remember what the GI limits are. So we make it really easy for you to remember those guaranteed issue benefits. So now back to the title of the presentation. So those are the two of our hottest selling products in that senior market. But what are the tips? And the biggest, number one tip is educate your client on the out-of-pocket costs associated with the plans. Okay. I think that too many people focus on the premium and not actually on receiving care. And that's a real shame. I think as an industry, we do a bad job of only focusing on the premium and not focusing on receiving care. And it's I don't consider writing a $0 Medicare Advantage. That's not really, you're not educating the client. To some degree you are, because you're educating them on the plan. But most people focus on the premium, saying, hey, I can get this plan, zero premium plan, and not talking about receiving care. And so you need to educate your clients on the out-of-pocket costs associated with the plan. And if you go out, schedule of benefits, right, or explanation of benefits, it lays it out. Here's a plan I pulled out, the document, and it says right here what the maximum out-of-pocket is. So lays it out for the client. Make sure that when you're, talking about the Medicare Advantage plan, you are showing them what their maximum out-of-pocket is. Then it goes through and it lists what all their copays are. And I didn't pull out all the copays because it gets a little bit redundant. But again, on this particular plan, there's a $395 copay for days 1 through 5. And so you need to make sure that you are educating them on what their out-of-pocket costs are. And then it's a simple transition, right? You can just say, do you want to, you would be responsible for these out-of-pocket, or we can take a look at what utilizing insurance would look like to pay for these costs. A lot of my clients, like in your position, decide to cover that exposure with insurance, right? I guess there I did have the ambulance rider, but starting the conversation. So as you can see, copays for a hospital stay or a stay in a nursing home following a hospitalization can add up quickly. You can either pay for these costs out of pocket or utilize insurance to minimize some of the exposure. Here's how utilizing insurance would work, right? It's not hard to bring these up if you're educating them on the out-of-pocket costs, right? Because then after that, you need to talk to them about the solution, and maybe an accident plan or a hospital indemnity plan or both would single option aversion. So there's a book, it's called The Science of Selling, and it kind of uses some different scenarios to reinforce different sales techniques. And one is single option aversion. And basically what this states is if people are presented one choice, they're less likely to buy. And they actually used an old study on VHS or VCR sales. So you can imagine how old that study was. But basically, if a person was given a choice of purchasing one a VCR, only 30% of the time they bought it. But if there were two VCRs out there, 30% bought option one, 30% bought option two. But the point is, it's not which one they bought. The point is that 60% of somebody actually bought a plan. And so if you show your clients two options, they're more likely to select one than if you just showed them one option. And so in our point of sale tool, we actually make it real easy for you to do this. You can actually kind of show a good, better, best scenario here. Option one, what I did here is I did just the daily hospital confinement and then the nursing facility, being in a nursing facility, because really those are going to be the two big ones that might, make them reach that maximum out of pocket. And so this is kind of just the, basic policy here, $36.70. This one, I added some additional riders as well to cover those. And I actually added a critical illness plan as well. Now, the reason I would do that in that senior market when selling a Medicare Advantage plan is because of the copays for chemotherapy and some of the other prescription drugs, right? You might have a 20% copay for that chemotherapy, and so that could add up as well. So sometimes people look at critical illness to kind of cover that risk. And so here I did the riders and then also the CI, and then the other option I just increased kind of some of those benefits. So again, good, better, best, ranging from $36 a month all the way up to $93, but you're giving the client options, and they're going to select the one that makes the most sense. And this is what our best agents do, right? I hate to like oversimplify things, but this is what they do. They show them, what it looks like, give them a couple options, and then let them decide. Last one is just leverage additional benefits. A lot of agents are hesitant to, ask for a premium when they're selling a $0 premium, Medicare Advantage. But remember, if you're selling them that Medicare Advantage plan, you're probably getting some additional benefits, right? They might be having some built-in dental benefits, right? So you're saving them, $30, $40 that would be otherwise having to purchase a standalone dental plan. Same with vision benefits if they're built into the Medicare Advantage plan. Hearing benefits if they're built in. Over-the-counter drug benefits if they're built in, or any other additional benefits. So when you're walking through that Medicare Advantage plan and kind of educating them on some of the additional benefits built into that plan, make sure you're saying, we can use some of these that pocket share that would otherwise be going to those benefits to pay for the plan. And I just go back to this. The biggest reason agents give for not selling ancillary products is they're used to selling a $0 premium. And I just say, are you an order taker or are you a valued professional? Seriously, it's not hard to sell a $0 premium plan. Even I that work for the home office can sell a $0 premium plan, right? It's not hard. So a value professional is going to educate them on what their out-of-pocket costs are and then discuss strategies to accomplish them, right? Number two is set the expectation up front that monthly premium savings should be used to create the best coverage, right? Especially if, let's say, they're enrolled in Part A and Part B and you had them in a med sup like a Part G, you're probably going to get them some premium savings. Well, let's utilize some of that to, create the best coverage for them. So set that expectation up front. And then again, look at the big picture, right? Look at both premiums and receiving care, okay? Too many people only focus on the premiums and not the aspect of receiving care, right? So, talk about, maximum out of pocket, copays, and, some of the other benefits in it, but we're setting that expectation that some of those savings is going to be used for it. And then finally, your job is just to educate them and let them decide. If they say, nope, I just want the Medicare Advantage, I'll self-insure the rest. You say, great, I did my job to educate you on how to utilize insurance with that. And then you would be good to go. But it's a different mindset. Anybody that is enrolling someone in Part A and Part B is going to talk about a med sup, right? And there's no, I guess, stigma or reason they wouldn't. It's just a natural conversation. It's the same thing if you're selling a Medicare Advantage plan. You should be talking about ways to cover those copays. And I think we're going to see a big transition in the marketplace as agents pick this up. And the ones that don't, they're going to lose clients, and they're already losing, that money for additional premium and commissions. So, John, with that, that's what I had prepared today. So I will go ahead and give you back control. We can wrap this sucker up.
All righty. Thank you, Seth. One of the questions that did pop up, Virginia's asking if we can offer these products at times separate from the open enrollment period. And yes, Virginia, there is a Santa Claus. I had to bring that out. You expected that. And yes, you can sell these year round. I think it's also important to note that these cover, in addition to any other coverage there is, so it's a private fee for service type of arrangement. So it layers on to the other coverages that they have or don't have. And we need to take into account the non-medical expenses that folks have additional to what they have with medical care. So some things that we need to make certain that we are aware of there too. Thank you, Seth. I'm going to go over some things really quickly and wrap up this up. Why would you want to work with us here at Premier Marketing? Well, we're going to try to make certain that things go as smoothly as possible for you from the beginning, and that includes electronic contracting. We have a system that you can set up an agent profile, put all your information in there, and select carriers to contract electronically in that fashion. Many of the carriers, however, we send direct electronic links to make certain that, well, it's completed and you have it in play as quickly as possible. We do offer discounted E&O for qualified agents. Well, you got a contract with us. And so you own an errors and admissions policy that is not adding you to a blanket E&O for just one program. You own it. It takes care of your obligation for this type of coverage with any insurance company, regardless of whom you contract through. Premier is big. We're huge. We have a broad portfolio. We're in all 50 states. We don't offer everything everywhere. I don't know of anyone that does. This takes care of you regardless of whom you contract through. We do also try to make certain that we protect your insurance license too by offering discounted continuing education programs through our association with WebCE. And as an independent agent responsible for your own benefit package, well, you can create a modified guarantee issued disability income program for yourself on which you are paid a commission as well. I mentioned at the outset of today's presentation that it is being recorded. So has past presentations, and they are available on our website and on our YouTube channel as well. So that gives us an opportunity to go in and visit about different types of marketing programs to present these sorts of programs into the community. So different things that can make you successful in offering the products. It's nice to have a shiny car in your garage. Boy, even better if the thing drives and you can get somewhere with it. That's our intent with this video library. We do also offer electronic tool access without cost to you through Medicare Center. This gives you an opportunity to quote multiple programs through multiple quote engines, collect all the information you need to be compliant. Keep in mind, ancillary products don't require a scope of appointment, but there are a few of them that are mentioned on the scope of appointment, and it makes for a great transition for those programs to present them. So when you do those side-by-side comparisons, we're able then to make certain that they're done so compliantly. The scope is kept in play for that 10-year period that's mandated by regulations. Same thing with the call recordings and the storage. This system does also offer a PURL, a personal URL, so you have a presence on the web. You dictate what is the programs that are part of that system, and then if someone goes and shops and enrolls on your website, they're yours. That's your commission. That is also your member. It's important to note then that that is all done compliantly, and you can use that PURL in your newsletter, in your email correspondence, however you feel best to publicize that, even attaching it to a website you may have outside of the system. It does also offer a client database with switcher tags. What this does is give you the opportunity to look at the folks that you got in the system, the ones that are prospects, possibly folks that you haven't sold, and those that you have. But it makes certain that the ones that you sold in there gives you an indication of who may be more susceptible to a change. And that might be because of a specific purpose. So regular contact with your book of business, offering programs like AccidentWise and other ancillary programs is a great way to keep your book engaged with you. Lead Center, we're going to talk about in just a little bit. But one of the things I think that some folks will overlook is the fact that, hey, I got a lead, didn't sell it. What's going on? There are different things within this system too that can help you be more successful in your selling techniques. There's different call scripts in there. There's some different pieces that can be very valuable to you. And we know if our close ratio is higher, we need less leads to make our goal as well. This is available in a mobile application. And as one of those quasi-celebrities say on television, it's available, it's free. So you don't have to worry about it. A cost with this if you contract with our organization or one of our platform partners. We do also offer a notification to you as to the different incentives that are available to an agent by marketing different individuals. So that's made available on our website. This is going to be taken behind the wall with the agent portal because of new regulations that come in play, but it gives you then the indication or the information you need on what your true compensation is for a product and how that might help you qualify for carrier trips and premier incentive programs as well, where this last year, the producers convention is finally back. So the challenges that we had with the pandemic, well, there are a large number of agents that are headed to Mexico this very next month with this trip. Future incentive programs such as this will be announced in the very near future. We want to make certain that you have an opportunity as well to get in front of people. How can we help you? Well, you can cold call for different programs that allow that, and we will make available a contact list custom ordered for you, and the cost varies according to your relationship with us, plain and simple. It can be low cost or no cost. We also offer the different programs that can help you be successful by reaching centers of influence in your community. So these community-based programs, such as the retail programs that go on, Walmart, and the ones that are offered by the different carriers, keep in mind, health programs are part of that deal, can be very successful. And if you've worked retail and think that you were done on Pearl Harbor Day, shame on you. That's a great opportunity year-round simply by staying in touch with the folks that you talk to through a 6 or 7 week intense opportunity during open enrollment. These are also great programs to visit with faith-based organizations because they reach a portion of the population that doesn't respond to other marketing opportunities. A great way to work with them. And we have actually a webinar coming up this week or next week about faith-based opportunities and how you can take advantage of that opportunity. We also speak to different provider marketing incentives or initiatives, I should say, that can help you. So different programs can come into play with different lead sources, and our direct mail support is based on production. It cuts the price of a direct mail program. Keep in mind that postage went up again this year, but this can give you then the opportunity to offer an inroad to folks that do still respond to mail. It's not dead. And you can qualify through health programs and through final expense opportunities as well. So you can double dip through each month based on production. We work through preferred lead vendors where we vet their systems and the correspondence they send out on your behalf to solicit the business. And we also offer direct mail response leads that have come back where you're not controlling the entire mail initiative, but you're looking at never distributed direct mail leads that you can use to plug holes in your calendar. Now, these costs will vary from time to time, from area to area. That's the law of supply and demand, but they're pretty consistent as a very good buy for an opportunity to fill your calendar. One of the internet lead programs that we offer is through a program with Facebook. It's available for final expense and for Medicare. What you have with these is an opportunity to get a very quick response. People will raise their hands, hey, I want more information on that. We want to make certain, however, that you're aware of the fact that they're responding quickly. They expect you to respond quickly as well. So something to keep in mind when you look at internet lead programs for Facebook, or a new program that we rolled out for a program that takes advantage of search engine optimization to deliver leads that are really fresh for you as well. Cost on this program is available to you through your agent marketer with Premier as well. Lead Center. This comes within Medicare Center, and this is a program that you can designate how much you want to spend, how much leads you want to come in, how fast you want them to come in, and do you want them through a hot transfer or through the CRM system itself. Either way, it's a great way for you to have a regular supply of people to speak to at a very economical cost through a system you're going to be using anyway. The T65 locator that was mentioned very briefly before, well, this is another program that you basically download to a smart device. They find that you have a contract with us. It registers you to then use a geographic definition of where some of these folks are. You fill in different parameters on the search that you do, and it plots it out for you as to where they actually live. Very helpful for folks that are door knockers that may have missed a appointment on a stacked schedule. So a great way for you to make certain that you utilize your time as efficiently as possible as well. That referral program, it's something that reminds us to speak to the opportunity to have one lead go forth and multiply. And it's not just the sales process. It's also a way to engage that book of business. So as Seth mentioned, visiting with your folks about AccidentWise, this is an opportunity for you to reach out to your book of business and say, hey, I've got a new program available to me. This is what it is. Do you know of folks that could benefit from it? So you're indirectly asking for referrals, but one of the first things many of them will do is, hey, what about me? Great way to keep your book engaged and in your renewal stream. We do all this because we want your business. We want to be referable to you and the folks that you work with in the insurance arena. And it gives you then the opportunity to do things quickly. Contracting for these products doesn't require any additional certification. It can put you in play really quickly. Commissions are paid promptly, and it gives you then the opportunity to add to a portfolio and diversify your marketing plan as well to make certain that you're utilizing these programs not just to take care of the need, which is paramount for offering these programs, but a way to get in front of people using them as well. So all that said and done, I'm going to check for questions. I think we've done a pretty good job here, Seth. And at this point in time, for those of you that have worked with Premier in the past, I thank you for your business. We look to enrich that relationship through programs such as what we've discussed today. For those of you that are just checking us out, thanks for the opportunity. We look to earn your business in the very near future. But for everyone who's viewing this presentation, you've invested your most precious resource, which is your time, and I thank you for that. So let's touch base here again. Yep, questions are satisfied. Seth, I thank you for your participation. And what we're going to do now is basically say, until, hey, we meet again, I wish you good selling. Thanks so very much. We'll talk to you soon.